Good evening, everyone. A very warm welcome to today's awareness session Understanding Breast Cancer Awareness, Screening, Diagnosis, and Treatment, an initiative by Voice of Healthcare. Breast cancer is one of the most commonly diagnosed cancer among women today. In India, we are seeing a significant rise in cases, including among younger age groups. While this can feel concerning, there is also hope. Advancements in screening, diagnostic, and personalized treatment are improving the outcomes like never before. The most powerful tool we have continues to be awareness, understanding risk factors, recognizing early signs, and seeking timely medical guidance. Today's discussion is designed to bridge the gap between medical science and public understanding. We aim to create a space where complex oncology concepts become easier to understand, where myths are addressed, and where patient and family feel empowered with the right information. It is my privilege to introduce our distinguished panelist, Dr. Chanchal Goswami, Senior Consultant Oncology, Manipal Hospital, Kolkata. Welcome to the session, Dr. Chanchal. Dr. Kiran, Consultant Medical Oncologist, JSS Hospital, Mysore. Welcome to the session, Dr. Kiran.
Thank you, Dr. Vaishnavi.
Dr. Velu Sarathy, Consultant Medical
Yeah, hi. Good
Oncologist,
evening, everyone. Thank you.
Baptist Hospital, Bangalore. Welcome to the session.
Thank you, Dr. Vaishnavi.
Dr. Chandralekha, Consultant Medical Oncologist, Murugan Hospital, Chennai. Welcome to the session, Dr. Chandralekha. Dr. Roja Joseph, Consultant Medical Oncologist, Renai City Hospital, Cochin. Welcome to the session.
Thank you, Dr. Aisha.
Ms. Neerja Malik, author of I Inspire, podcast host of I Embrace, inspirational speaker, cancer conqueror, and counselor. Welcome to the session, Ms. Neerja.
Thank you, Vaishnavi. The divinity in me bows down to the divinity in all of you. Thank you.
So thank you all for joining us and for contributing with your expertise to this important conversation. So let's begin our conversation by talking about awareness, screening, and early diagnosis in the first segment. So, Dr. Chanchal, my first question to take this conversation forward is to you. Breast cancer cases in India are rising, and we are seeing younger women being diagnosed. So, what are the most common critical risk factors women must understand today, and how can early screening truly change the survival outcomes?
Well, thank you, Vaishnavi, for making me the opening batter for this session. And in this era of T20 cricket, I think this is like a T20 cricket, and we have to finish quickly whatever you throw at us. And it's correct that what you have said, that in India we see breast cancers coming up at least a decade earlier in comparison to Western data. And we see a lot of younger people coming over here. And coming to your question, I think there are two, three important issues why it is coming in younger, because breast cancer traditionally has not been a younger woman's disease. It's essentially a mid-age disease and elderly people's disease. But why it is coming, there are two, three reasons. I think the most important thing is lifestyle. Breast cancer is a lifestyle disorder, and if you look at the lifestyle, I think most of our women are walking, and they are outdoors throughout the day. Most of them are not willing to start a family early in their life. Many of them do not want to breastfeed their baby. Many of them are on oral contraceptives or contraceptives for the long period of time while they are working. Their work pressures prevent them from bringing up a family early. So these are reasons. And of course there are other habits. You see women start smoking much more than what they used to do earlier, and a lot of young women, especially those in the corporate sectors, you will find them smoking. So these are, and of course diet, obesity. obesity is another issue which has to be concerned, because obesity is directly linked with breast cancer development. And you will see a lot of women, they are young women, are quite obese, and these are certain things what young women have to be aware of, that what are the risk factors of breast cancer, and accordingly they have to control their lifestyle accordingly. So they need to have regular exercises, they need to have a look at their diets, they need to have a check at their weight, they need to rear up a family as early as possible, they need to breastfeed their babies. These are important issues. Apart from these, there are issues like congenital factors which you really can't control. These are something which you cannot control, but what you can control are those which is controlling your weight, having regular exercises, good diets, regular checkups. You need to go for those women who are working, and I think most of these women are corporate women who has a regular corporate health checkup. So you need to go for your regular checkups, and it is a part of your good health practice, I would say. And of course, resist from becoming a smoker, regular drinking habits, and stop taking junk foods, or foods which are not suitable for healthy living. And these are important factors, and one must be aware, because what we see that women are getting breast cancer at least a decade earlier than the Western population. And many of these young women who come with breast cancers do have aggressive disease, and the more younger the breast cancer is, they are likely to be triple negative or HER2 positive disease. And more elderly breast cancer is going to be indolent breast cancer, hormone receptor hormone receptor positivity. So I think these are the factors which need to be kept in mind, and people need to be aware, and more such programs need to be conducted to make general people aware that how they can prevent breast cancer, and how they can keep themselves in check, and get, even if they have it, get detected early. Because the major thing is that ultimately breast cancer is something, if you detect it early, is a curable disease. So majority of the breast cancers can live a very healthy long life. Thank you.
Correct. So thank you so much for putting it up so well that it requires screening and the emphasis on the corporate setup very importantly. So my next question is to you, Dr. Kiran, that in your clinical practice, what are the biggest barriers that prevent women from coming forward for screening or early diagnosis, especially in tier 2 and tier 3 cities? And how can we address these gaps more effectively?
Yeah. Hi. Good evening, everyone. Am I audible?
Yes, yes, you are very well.
Yeah. Yeah. There is a lot of things needs to be discussed here. First of all, thanks for this evening and making me a part of it today. So the thing is, many cases, as told by the previous speaker, like many cases are getting diagnosed very early, and still there is a good number of cases which are not diagnosed at proper time and at the proper stage. So there are a lot of things which need to be taken care of. One thing is the points which are to be noted is one, no pain means, sorry, some patients think that if there is no pain in the painless means, if there is no pain in the swelling or anything in the lump, then there is nothing wrong with that. So no pain means it's nothing, like it's not cancer. For all common people, they need to know that cancer lumps in the initial stages are usually painless. So we should not think that if there is no pain, that means it's not cancerous. It is a good, it's a good tumor. So it's not like that. Any lump in the breast, any size, no pain also, needs to be evaluated properly at the right time. And the second point is, there is lack of awareness about self breast examination. Even though we have been advertising so many things in public platforms and also in social medias and all about the self-breast examination. Still, so many people doesn't know about the proper method of self-breast examination. One thing. Second one is even many of the rural population, rural females, and also in some tier 2 and tier 3 cities, what happens is the females are very much hesitant to show to a doctor whenever they feel a lump or swelling in the breast, mainly because of the examination, the discomfort. Sometimes they feel like whenever they are examined by some male doctors and all. So that is one a hindrance where many females are not coming forward for examination. And next point is many of the population think that once a cancer is diagnosed, it is a death sentence. That is a myth. So I think by now many of the people know like it's not a death sentence. Many of the cancers, this it is a normal dialogue where we used to tell early cancers can be cured. So the same thing applies here. Breast cancer diagnosed at very early stages are curable, but even though if breast cancer is diagnosed at late stages also, there is a good amount of survival. Breast cancer is one such malignancy, one such cancer where even though if it is diagnosed at stage 4, still there are so many medications, so many treatments like hormone, so many things, treatment able to prolong the survival of CA breast even in 4-stage disease. And the utmost important in Indian setting in tier 2 and tier 3 cities is many of the females are like they are very much engaged in many of the responsibilities, household responsibilities, and they used to take care of their families and other things. By doing this, they neglect themselves, they neglect their self health, they neglect their self care. So routine health checkup will be done by many of the other persons except the homemaker. So that is one important thing. And a lack of screening facilities in taluk and rural areas, basically in tier 2, tier 3 cities, where not many centers will have mammogram facilities. And so if they are there, then people should be educated. They should create awareness about the cancer screening programs with the availability of mammograms or even the ultrasound mammograms and all. So that can be done. By doing this, we can able to overcome the difficulties in diagnosing breast cancer in early stage. So in tier 2 and tier 3 cities. Thank you.
Correct. So, since now we had a mention of mammograms, my next question is to you, Dr. Velu, that there is often confusion around mammograms, self breast exams, and clinical exams. So, could you clarify what the ideal screening protocol should look like for different age groups? I think he has dropped from the call. Maybe there's network issue. So I'll take up the next question in the meantime while he joins back. So my next question is to you, Dr. Chandralekha, that many women ignore early symptoms or misinterpret them. So what are the early warning signs of breast cancer? What should never be overlooked? And when should someone seek immediate medical consultation? Yes, Dr. Chandralekha, over to you. Am I audible to you? I'll quickly connect with her offline. Yeah, so I can see Dr. Vinu, you're back in the session. Am I audible to you? So, Dr. Roja, are you there? Should I take up your question? You are on mute actually. You can just unmute yourself. Yeah. Yeah, so we'll be
Am I
discussing.
audible?
Yes, yes, you are. So I'll quickly
Yeah.
ask you that the with advancements in diagnostics, so including biomarkers, testing, and imaging technologies, so how has early detection improved treatment personalization in breast cancer?
Of course, if we can detect early, it is 100% curable, especially in stage 1, stage 2, stage 3, etc. So, if you can do screening starting from, for average risk patients starting from age 40, annual mammograms, we can detect it in very early stage where with the surgery and minimal treatments, chemo and radiation, we can completely cure the disease. Even in stage 1, if we can do without chemo, also is possible. In early stages, if we can do oncotype DX tests like that, the risk of recurrence we can assess, and we can avoid the chemo, etc. That's what we practice if we can detect the disease in the very early stage. And also for young patients who get the triple negative breast cancer, and patients with breast cancer less than 50, we always do the BRCA test by NGS, etc. And then we can screen the families also, the first degree relatives with for this BRCA mutation or related HRR mutations, and we can do screening of them also from the young age, or from less than 10 years from the index case in the family. So that's how we do practice, and we try to get diagnosed breast cancer at a very early stage.
Correct. Is there something else that you would like to add, or should I continue the conversation?
Yeah, then as you specifically asked about biomarkers, that those things help in like PD-L1. If you check the, one second, I am actually driving, so I am
Correct,
stuck
correct,
in a
correct.
block. One second. So if you can check for the markers, estrogen receptors, progesterone receptors, HER2, all those in the breast cancer cells, and we can.
I think Saturday is the real problem. Everybody's rushing somewhere or the other. So we have lost her in between. Dr. Velu, are you there on the call? If you can just say yes.
Hello, ma'am.
Yeah, yeah, yes, I can hear you.
Yeah, am I
This,
audible? Yeah,
yes,
now
yes,
it's
this is
fine.
better. So maybe you can continue here. So as we are discussing about screening and early detection in this segment, so my question to you was that there is often confusion around mammograms, self breast exams, and clinical exams. So could you clarify what the ideal screening protocol should look like for different age groups?
Yes, ma'am. Thank you. First of all, breast is a superficial malignancy. Like unlike other tumors, like deeper tumors like stomach cancer or pancreas, this is superficial. So there's a high chance that it can be picked up much early, and then the cure rates are very high, like Dr. Chanchal sir has said. So I think compared to the West, where screening programs or screening protocols have been mandatory due to their health program or insurance regulations, here not many of us actually, not hardly 20-30% of the population even undergo screening regularly. So I think what should be kept in mind is any lady above the age of 40 years has to undergo an annual mammogram. A mammogram is basically comprises of an x-ray of the breast at two angles, with it may be complemented by also an ultrasound, and this is the earliest and most effective way of detecting even what we say as stage 0 breast cancer or breast cancer in situ. And This is done annually up to the age of 55, and if there is no abnormality detected, then we could possibly make it once in 2 years up to the age of 75, and then we take a call based on how fit the patient is. So this is mandatory. Beginning age of 40, there are some guidelines which says 45, but I think age 40 to 45 we must begin mammogram for every lady. And then of course self breast examination and clinical examination by the doctor. I think these days the Western guidelines are not giving that much more importance, because they know the woman is definitely going to come in for a mammogram annually. But in a country like India, where not much of screening or is happening voluntarily, I think self breast examination is still a very important tool. I think self breast examination, there is enough data, the detailed way of doing it every month, standing in front of the mirror with hands on the hip and raised above and then lying down, how to do it, every step by step is available, enough data on the internet and pamphlets being circulated. So I think every woman, so we call it, rather than self breast examination, we say self breast awareness, and that is very important. I think every woman must know, and most of the time when it's picked up early, it is mainly picked up by the woman first, and she is mainly the first person to pick it up, hence we detect it at the earliest stage. So it is very important tools. Self breast examination still cannot be undermined, and in India it still is a major tool. And of course mammogram must be made mandatory for every woman above the age of 40 to 45. So these are the two most efficient and important tools. Of course, for some women who have a BRCA mutation, or some women at a higher risk of cancer, we say, who have many first degree or secondary relative with cancer, for them the cancer screening starts much earlier, maybe at 25 or 30 years of age, and this will be decided by the treating oncologist. So this is must be kept in mind. So mammo is a must for every woman above the age of 40, and self breast examination still plays an important role in our country. Thank you.
So, thank you so much for explaining it to us and telling us that what is the right age and when it should be took up. And yes, enough data is there on the internet, and of course, pamphlets are doing the real work there. So, my next question is to you, Miss Neerja, that as someone who has personally survived breast cancer, what were the early signs or turning points in your journey that you now wish more women were aware of? And how important is self awareness in early detection?
Wonderful question. First of all, I call myself not a survivor. I call myself a conqueror. Uh, I prefer to say conqueror than survivor, warrior, fighter, etc. Now, what I would like to share with you wonderful people here is that yesterday, the 13th of February, 28 years back, I was diagnosed with left breast cancer, fourth stage. And as one of the doctors said, yes, things are available now to be able to cure and take care of the cancer patients who have been diagnosed. But I must say that 28 years back, I was given the judgment that because it's fourth stage, because out of 21 nodes, 9 were uh, positive, they said that there's no treatment for you in India. You have to go abroad, either to America or to France. Stem cell research had just started then. And I wept for 3 days. And I need to give you this background because I hope that people who are, women who are going through cancer, and even the wonderful people here, get a little glimpse into what actually happens when someone is going through such a traumatic, finding. So, yes, I was not worried about dying. But my twins were only 7. Now, these are things that happen to most women because either they just got married, the younger ones are getting diagnosed now, or they've got small children, or, the family is dependent on them. They might be the working woman for the whole family. So I need to say at every point that it is very important to have a kind of a mindset that will accept and acknowledge the diagnosis. Because only when you move out of denial and you come into the sphere of acceptance and acknowledgement, and then you can say things like STPA, which is study, diagnosis, plan of action. And so this is very important. And also, the trouble in India, like one of the doctors said, is that the woman puts herself on a back burner. She will always have excuses like, it'll go away, I don't have time, the child is unwell, or the neighbor is unwell, or she will be the first one to take them off to the hospital. But when it comes to her, so along with this awareness, I would like everyone to, you know, give an emphasis to the fact that, hello, we're not doing these tests to, you know, find out that something's wrong with you. We're doing these tests as a baseline so that every time you get your test done, you can just compare and contrast it very, very easily with the previous ones. So I think the fear about the stigma and the fear about going in for these tests and the fear that, oh God, I will find that something is wrong, better not to go and to just shut myself off. All these things have to be approached with that kind of a situation that no, this is not it. We're going in not because we expect to find something, we're going in so that we have a baseline to be compared with the future tests. So I think this is a great responsibility. Yes, there is definitely a jump in awareness. There's definitely a jump in how many people are going in for mammograms and for the younger ones, sonographies. But the purpose should be made as simple and fearless as possible. Because after all, we're all human beings. So, left breast when I was 44, and right breast when I was 51. And God is great. I'm still here to tell my tale, though I was given very short while to live, because I concentrated on the fact that yes, my twins are only 7, and more so, what will happen to them? And then the thing was, wipe my tears. And I love the name of that shampoo, No More Tears. And I said, I'm going to have a goal. And my goal was to live for my twins. And I'm so happy to share that Friday the 13th in 1998 was, according to me, a bad day. But now I feel it was a good day because I was diagnosed. So I think we need to change our mindset on everything. You got diagnosed? Oh my God. No. Thank God you got diagnosed. Because then your treatment can start and you can come out of it. Yes, someone mentioned that stage 1, stage 2, stage 3, stage 4. What keeps you going on beyond that is goals in life, your family, your friends, your parents, everything, and the josh to move on. So basically, that is what I feel, that awareness is coming a long way, but the concept of why we are going into it should be, a little more modified with uh, sympathy, empathy, understanding, and we should move on. Thank you, Vaishnavi. Thank you so much.
Correct. So this was from a very different lens, and yes, you are a conqueror for sure. And I believe those who are listening to this session feel empowered, and instead of saying, "Oh no, I got diagnosed," they say, "Thank God that I got diagnosed," and we have the right set of doctors these days to treat it well. So, before we jump on the next section, I would quickly ask Dr. Chanchal to for you to throw some light on the question that what are the early warning signs of breast cancer, and what should never be overlooked. Since I think without addressing that question, this session would be left incomplete. So, if you can quickly highlight those concerning signs.
Well, early warning signs of breast cancers in one word is do not overlook a lump in the breast. That is number one. But the rider is not necessarily all lumps are malignant. In fact, 10% of the lumps in the breast would actually be malignant, 90% would be benign. So, having a lump in the breast should not make you afraid, but it should make you aware that you need to visit your doctor and you need to see. And but at the same time, you need to see specialists as well who deals with breast tumors, because many doctors will actually frighten you when you have a breast lump, and they will unnecessarily do many tests and do biopsies. So I think that is important. Apart from the lump in the breast, there are other signs and symptoms, but the most important, other than that, is discharge from the nipple, which can be a bloody discharge or something. Again, a bloody discharge does not necessarily mean that it is a cancer. It can be many other things as well. And of course, any change in shape and size of the breast, which is very important, the skin of the breast, the nipple of the breast, whether the nipple is getting retracted or not. So these are essentially early signs of breast when the tumor is limited to the breast. Of course, if the disease spreads to other areas, you will have many other signs, symptoms. But when we talk of signs and symptoms of breast cancer, in general, these are the signs of breast cancer. But as I said, a lump in the breast not necessarily means cancer. Rather, it is something which needs to be explored, because only 10% of the lumps in the breast will turn out eventually to be malignant.
So thank you so much for taking it up, and that makes us to jump
Vaishnavi,
into the. Uh,
may I just say something here?
yes, yes, please, please.
So, what happened in my case, and he brought it to my notice, is that I was getting a massage done, and the dates are very clear. I got a little pain on my breast, and I was, uh, you know, a very, very obsessively compulsive aerobica. So, you tend to put it off, you tend to give reasons that, oh, I must have overdone my arm exercises, and that's why. But something made me, for 10 days, I felt the ache, but it didn't go away. Normally, a muscular pain should. And then I got a little, let me say, I felt that I need to do something about it. And then I went to the doctor and then discovered that it was now got the mammogram done, got the sonography done, got a biopsy done, and that was how it happened the first time. And the second time, because I had experienced that the first time, 7 years later, the second time, I had that same, I lay down on my stomach and that same kind of chuban. It wasn't an ache, it wasn't a pain, it was just a chuban. And that had it. So I woke up my husband and I said, I've got that. He said, no problem. You go to the hospital every day to Counsellor, get yourself tested. So, yes, you're very right. One needs to be aware of one's body. Earlier, it was a stigma to even talk about our body parts. And leave alone, we're just getting into the thing of feeling our body parts so that we can discover where the problem lies. Thank you, Vaishnavi. Thank you.
Thank you so much for adding up to that. And this session is for public awareness, and I hope the right set of people are aware. The next segment in we'll be talking about treatment, survivorship, and holistic care. So my next question is to you, Dr. Chanchal, that breast cancer today includes surgery, chemotherapy, targeted therapy, and immunotherapy, and uh, the others. So, how do doctors decide the most appropriate treatment pathway for each patient?
Well, it's a very appropriate question, Vaishnavi, but at the same time, I must say, when Mrs. Neerja got treated and today's treatment, there has been a huge difference and shift and paradigm shift in the treatment of breast cancers. And breast cancer today is no longer a single doctor disease. It has to be dealt with a multidisciplinary team that will include a surgeon, a radiation oncologist, a medical oncologist, a pathologist, a breast radiologist, and so on and so forth. And there are so many things. And as you rightly pointed out, if I want to summarize this question, which is actually a crash course in the treatment of breast cancers in a very short period of time, I must say that breast cancer treatment is decided by two important things. One is the stage of the disease, and the other is the type of the disease. Now, breast cancer by nature are usually three types. One is the good variety indolent breast cancers, which are estrogen and progesterone receptors positive, which are hormone dependent breast cancers. They are essentially indolent disease, usually found in the elderly group of patients, and they are the best breast cancers to have. The next one is the HER2 positive breast cancers, where they overexpress the HER2 gene, which are a very aggressive variety of breast cancers. But in the present context, they are highly treatable. And the other variety, as we were talking about, is the triple negative breast cancers, which means that they neither express the estrogen receptor and progesterone receptor, nor do they express the HER2 gene. So they are the bad varieties of breast cancers, are the most aggressive varieties, and they are triple negative. Why I am saying this? Because the treatment actually depends on this variety of breast cancer. And of course, the stage of the breast cancers, whether the breast cancer is a stage 1 breast cancer or a stage 2. Stage 1, stage 2 means the disease is confined to the breast. And I think there is a lot of background noise. Some of the people's uh, microphone should be switched off when they're not speaking. I think that should help. Yeah, right, that's it. So the stage of the disease, where stage 1, stage 2 are essentially called curable cancers. Stage 3 is something which is in between, which is locally advanced or loco-regionally advanced. Even a good section of them are highly curable with the present context of treatment and present modern treatment available. And of course, stage 4 or the metastatic breast cancer, where the disease has already spread beyond the confines of the breast, they are stage 4, even as somebody mentioned, and we have one of our survivors or conquerors, as she wants to be called. I think that's the more appropriate term, Neerja. Conqueror is the right word. So even advanced breast cancers are curable, and we have a proof right now in front of us in this panel. So this is what breast cancer is all about. So as a team, we decide which particular patient needs surgery alone, which particular patient needs surgery plus chemotherapy plus radiation therapy plus hormone therapy. And now there is another way of treating, which is immunotherapy. For triple negative breast cancers, we combine immunotherapy with chemotherapy. So essentially, when we decide on the treatment, stage 1 and stage 2 disease, which are by and large the most curable diseases, are treated usually with surgery, radiation, chemotherapy, and hormone therapy as and when necessary. Sometimes it may be one of these modalities, or it may be all of these modalities in combination in sequence. So that is essentially how we decide. When we come to stage 3 disease or locally advanced breast cancers, usually it is not surgery upfront. It is usually a systemic treatment upfront, which can be chemotherapy, immunotherapy. For instance, for triple negative breast cancer, it can be uh, antibody treatment or dual antibody HER2 antibody treatment along with chemotherapy for HER2 positive breast cancers, then followed by surgery, radiation, further chemotherapy, further systemic targeted therapies, and so on and so forth. And if they are ERPR positive, again hormone therapy. Even in ERPR positive, hormone receptor positive patients, one can add other treatments along with hormone, like the CDK4/6 inhibitors. Now there is evidence and there are drugs available. And finally, the more advanced diseases or stage 4 diseases, which are metastatic, if we may call it, can be treated mostly with depending, again, what I have said earlier about the receptor status, the HER2 status, the triple negativity and all, whether they should be treated with chemotherapy plus immunotherapy, or chemotherapy plus targeted therapy, or hormone therapy. And eventually, when it is required, they may undergo surgery or may not. Radiation would be required. But essentially, stage 4 disease, mind you, would need to go on getting treated till they are alive. Stage 3 and stage 1 2 would have limited treatment depending on the time frame and when they get cured. But stage 4 disease essentially will go on getting treatment, and they will be treated like chronic disease. And like we have diabetes medicine for the rest of our life or antihypertensive for the rest of our life, we need to have this medicine for the rest of our life and keep the disease in check. So this is in nutshell what I can say, the answer to a very, very important but a very challenging question which you have asked me to complete in a just very short period of time. In fact, this is the entire textbook of oncology treatment in such a short period of time. Thank you so much.
Yeah, thank you for utilizing that time and making it pretty easy to understand that yes, we need a multidisciplinary approach for the treatment of cancer in the right way. So, my next question to you is to you, Dr. Kiran, that now since we are talking about treatment, so there are side effects every time associated with it. So, side effects of treatment often create fear among patients. So, how has modern oncology improved in managing side effects and improving the quality of life after treatment or during treatment?
Yeah. See, in today's date, many of the patients, when we see, patients are more feared of chemotherapy side effects rather than the disease itself. Whenever they come with the disease, they are feared of chemotherapy side effects like hair loss and pigmentations and other things. So what I tell to those patients is like chemotherapy side effects are temporary, whatever it might be. But once it's not treated properly, then there is always a disease progression and it is irreversible. Once a disease progresses, it is not reversible. So my next question to the patient will be like, are you feared of treatment or are you feared of the disease? Which is more dangerous? Then they'll tell disease is more dangerous. Then I try to counsel them about the treatment aspects and other things. Of course, there are a lot of drugs which has come up, like some refined molecules which has come up, which has shown some lesser side effects. But the basic side effects of chemotherapy are there. But we do have some medications which can reduce the severity of the side effects, like nausea, vomiting, and loose motions and other things. Of course, hair loss is one side effect which is very much important for the women, which cannot be till date, apart from one treatment like head cooling treatment is there, which will reduce the severity of hair loss, but it doesn't stop it completely. So we, as of today, chemotherapy side effects are there, but all these side effects are reversible. To whoever watching this, I need to emphasize once again that these side effects are quite reversible. Once your treatment completes, then all the side effects will be reverted back. Hair grows back, pigmentation will be gone, and you will be more fine than earlier. Apart from chemotherapy, see, chemotherapy is just like, yeah,
Yeah.
connection.
So
Am I audible?
we yeah, now you are. You can go carry on. Yes.
Hello.
Yeah, you are audible to
Yeah,
us.
yeah. So I was talking about, yeah, I was talking about the chemotherapy treatment. So after see, chemotherapy is like
You are not audible to us. There's
yeah,
some network problem.
yeah. Now, uh,
Yeah.
hello.
Yeah,
Is
please
is it
carry
okay
on.
now? Yeah,
Yes, it's okay.
yeah. Chemotherapeutic drugs cannot differentiate between the normal cells and the cancer cells. So it will kill whatever the cells are dividing more. Rapidly dividing cells will be killed by the chemotherapeutic drugs. So it side effects are more with the chemotherapy. Now, other drugs used in breast cancer are, one is the targeted treatment. One targeted drugs target exactly because of the overexpression of the receptors. It attracts the drug towards itself, and then the drugs get binded and cells get killed. That is the reason targeted therapy doesn't kill the normal cells. So there won't be any side effects apart from some minimal things which can be easily managed with the target therapy. Then comes the hormonal treatment. Once again, the estrogen receptors or the progesterone receptors will be overexpressed on the cancer cells, in the breast cancer cells. So these cells will be killed by hormonal treatment. Those are tablets. Once again, these tablets also doesn't have any side effects at all, except for some weakness of the bones and bone pains and all that can be taken care of by some injections which makes our bone more strengthened. Then next comes the new era which is coming now, is the era of immunotherapy. After chemotherapy, targeted and hormonal therapy, we have immunotherapy. Immunotherapy is the one which doesn't kill the cancer cells directly, whereby it increases our immune system, it reboots our immune system. Those immune cells will attack the cancer cells and kill the cancer cells. Hence, these side effects of immunotherapy are also very minimal, which is seen only in 5 to 10% of the cases, that too very rare. So, immunotherapy, frankly speaking, doesn't have any side effects at all and can be treated very well. It can be combined with the chemotherapy, or it can be given as an alone treatment also. So these are the treatment forms which are used in breast cancer and the side effects. So one should be aware that chemotherapeutic side effects for breast cancer are very well manageable. So hence, taking chemotherapy is not a myth. Don't hear to your neighbors or don't hear it to your relatives that this will happen, that will happen, hair loss will. I have seen many patients, because of the fear of hair loss, even stage 2 disease patients have not taken any chemotherapy. Then later they come after 2 years with disease progression going into stage 4, at which time they are not curable. So just don't think about anything. Once you are diagnosed with breast cancer, go ahead, talk to the consultant, and then get treated first. Because what I feel, cancer is more dangerous than chemotherapy. Thank you.
Yeah. So thank you so much. My next question is to you, Dr. Venu, that precision oncology and genetic testing are gaining attention these days. So how is personalized medicine transforming breast cancer treatment the outcomes in India currently?
Yeah. So I think like 3 or 3.5 decades ago, it was just a one size fit all. Like anybody with breast cancer would come, they would have surgery, chemotherapy, and then possibly radiation. But with time, we have realized that breast cancer, not all breast cancer is same. And we now have, like Dr. Chanchal has already said, we have a estrogen receptor, hormone receptor positive group, a HER2 receptor positive group, a triple negative group. So all these we have identified by doing some marker testing on the cancer cells, which is, and going forward nowadays we have tests where we extract the DNA or the RNA from the cancer cells. We put special marker on top of the cancer cells to check for HER2 or PDL1, which is the immunotherapy marker. So it is going into a very specialized direction, and as of today it is no longer a one size fit all. Rather, each patient or each cancer patient, apart from staging which we see by a scan, we also see what is the type of tumor, and then it is a more personalized medicine. It is more individualized treatment rather than one size fit all. And previously any patient would possibly get surgery and then chemotherapy and then radiation. Now in fact most of our current studies are looking to what we say is de-escalate treatment, reduce the chemotherapy dose so patients have lesser treatment but which is more effective, and hence reducing the side effects also. So we are moving towards an era where de-escalating treatment, we are and it is more personalized or more specific to the tumor cells and less towards our healthy cells. So this is what is called personalized therapy. But what is to be remembered is not everybody gets the same treatment. So sometimes we have patients saying the other patient received immunotherapy, why am I not receiving? But it does not go that way. It is for specific type of tumor, it is a specific treatment, and then after surgery we say how well has the tumor responded. If all of the tumor is dead or we say necrose, then we may de-escalate treatment and give very minimal treatment post surgery. But When we give chemo or targeted therapy and post surgery we see still the tumor has not done that well, then we may escalate treatment. So this is the current era of treatment what we are following. And in terms of genetic testing, of course, we have certain criteria like a very young patient less than 50, or a patient with more than one relative, one close relative with breast or ovarian cancer, or somebody with two cancers simultaneously. We do advocate going for genetic testing, because as we are doing genetic testing, we are seeing around 5 to 10% of all our patients may have a genetic basis for the tumor. This is important for two reasons. One, because many a times we are seeing families with no family history having a genetic positivity. Possibly it was not known, or because we are testing more, we are finding much more prevalence and of these genetic cancers nowadays. This is two implications, because once a person is detected to have the genetic cancer or the germline mutation, we have to test the relatives also, the siblings and their kids, because we can detect we can start screening early in them and possibly prevent or detect it at very early stage. And if somebody has a genetic cancer, then we have again specialized drugs towards that mutation, and which is proves to be more effective than just regular chemotherapy. So this is how it is. This is what is the meaning of precision oncology, which means no longer the same formula for everybody. Rather, it is we find out what's the tumor, type of tumor, what stage. We start off with the treatment, and if the treatment works very well, we may possibly de-escalate. But if the treatment not working, we may escalate, and it is a very individualized approach. So it is not that the same treatment will be giving for everybody. It will be as per standard, but it will be escalation or de-escalation based on response, and we are moving into a targeted therapy and an immunotherapy era. Thank you.
Yeah, so thank you so much for highlighting that. My next question is to you, Dr. Roja, that breast cancer doesn't just affect the body, it affects mental health, family life, and social identity. So, from a clinical perspective, how important is integrating psychological and supportive care into the treatment? You need to unmute. You're on mute. Uh, Rahul,
Can you
yeah.
hear me?
Yes, yes.
Can hear, yeah, of course, breast cancer affects the patients, especially if it happens in young persons. It usually happens in their when the children are studying, or if they are in some major, they are in the into their work, etc. So all this will suffer when they go for treatment, and the psychological impact of hair loss, and the peers are going up in life, all this will affect them very much. So all we have a psycho-oncologist also along with us in our department, those who can afford. Otherwise, the doctor themselves give psychological support and form peer groups among patients so that they can support each other. And we always give the phone numbers of the survivors when the patients are in during the treatment time, so that they can support each other. It is better for a survivor or a patient who is currently undergoing treatment to support each other rather than the doctor alone supporting them. So we always keep that in our practice, so that they are helped. And especially in NGOs and other support patient support groups definitely help, and they are more needed in supporting the patients during the treatment and during follow up. And that helps in early diagnosis also, for screening of the patient's relatives or the neighbors, or those who in the same profession, etc., to come up for screening and detect cancers if present early. That's it.
Correct. Yeah, so my next question is to you, Miss Neerja, that as a cancer conqueror, counselor, and inspirational speaker, what does survivorship truly mean beyond a recovery? So, how can families and caregivers better support someone going through breast cancer emotionally and practically? You just need to unmute yourself.
Yes, can you
Yeah,
hear me?
yes.
So, first of all, I would like to say about myself. I cannot speak about other patients or what they've gone through, but I am going to put in a little bit of hereditary factor into this also, because when one is a cancer conqueror and a cancer counselor, one has also been a cancer caregiver, because I am the 46th patient in three generations. That's my grandparents, my parents, and my cousins to have been diagnosed. And Dr. Chanchal, I must tell you that yes, I had very, very advanced, I mean, not so much advanced as bang on treatment to, because it was high risk and all that kind of thing. But my treatment lasted only when the treatment got over. I didn't have any medication beyond that. So I did the first time have, for 5 years, I had some tablets, like those onco tablets, but the second time they said there's no need for it. So when I completed my treatment of surgery, chemo, and radiation, all three exactly in the order that it used to be, and the radiation, we only had cobalt. Now you can go shopping for radiation and have targeted and so on and so forth. So I do feel that a lot of work is required. And I'm very happy to say that when I start talking to patients who are resistant to talking to me, they just want to curl up and die. I am able to give them a lot of strength, because when they say, "Do you know what we're going through?" And I said, "Yes, twice over." "Do you know what our families are going through?" "Yes, my family went through the same thing." So, I think, a lot of strength and encouragement happens when someone has gone through it and is able to counsel. I think I would have counseled in these last 28 years at least maybe 1 million people. And let me make one thing very clear here, that we have this thing about, to use your word, survivorship. So someone told me when I was, had my surgery the first time, and I was so excited because, you see, 2 years back, I finished 50 years Golden Jubilee of being a social worker. And 1 year back, I finished Golden Jubilee. I celebrated it for being a teacher. So when she came to visit me, I said, "What do you do?" And she said, "I've started a support group." And I got so excited. And I said, "That's what I'm going to do. I'm going to start a support." And I was told then, "You can't. You have to be a survivor for 5 years." Now, why am I telling you this? I felt rejected, dejected, because that is where I learned that if you have a goal, you can overcome anything. But this shattered me, so I stopped. I didn't even think about it. And then my uncle said, "Go and meet this patient," and blah blah. That's how my counseling began, the very year. Now, if I had waited for those 5 years, I was diagnosed again 7 years later. Imagine the amount of experience I would have missed out on for those 5 years. So, like some of you said, one doesn't fit all. So I think we should do away with these. For 5 years, you cannot do anything because you're a survivor, and people will get upset or down, trodden if you get diagnosed. So I've gone through all those stages, and I feel that as a counselor, I find that I use a lot of visualization. I use a lot of love. I use a lot of connect with the patient. And I always feel like you use the right word. What about support? I feel that if you have a good bonding with your family, with your friends, that is where it comes into being. And I've got so much of experience because my father passed when I remember that my mother, wanted the doctor to, feed him. And towards the end, the patient does, stop wanting to. And then I told the doc, I said, you better tell her that you can feed him through the Ray's tube or, an IV or even make a hole in the stomach and feed him directly, but it will not be for him, it will be for you. So I just want to know that thankfully the breast, and one of you did bring it up, is outside our body. So if you have an apple that is a little spoiled, what do? We take a knife and we scoop it out and chuck it, and the apple is good to go. So I think the easiest, the good point is that the easiest kind of cancer that one can have is the one that's outside the body in the breast. And so one should look at it, okay, this is the best kind of cancer I could have got. And then there is a whole system of how you come out of it with help, of a little bit of help from your friends, from your family. And that support is what is really very, very important to get them, the patients and yourself, to go a certain way. So I feel that if we have that support, and I always say, please believe me, that the kind of faith you have and the surrender, the trust you have in God, that is the kind of faith you put in your docs. Because I always say, God is doc and doc is God. Because the doctors are there, yes, oncologists, surgeons, oncosurgeons, and oncoradiologists. They're all there for our benefit. And I will say our, and just have your faith and trust in them. They have your welfare at heart, and they will do anything and everything to uplift you from a point of, misery, sadness, physical ill health, and rehabilitate you. So I think that all of you are doing a wonderful job, and I'm so happy to be part of this. I feel that a lot of strength lies in family support. And you see, in the good old days, everything was hidden. Uh, let's not tell that person. Let's save that person. So, in that, there was a lot of, trauma within the family. You got a facade, and the other person knows indirectly that there is a facade, and maybe they're telling me lies. So abroad, the patient has a right to know everything. We've still reached the stage where if they're elderly people suffering, we don't want to tell them the truth. But this is what I tell my patients, that you meet your patient, your family member in the ICU, and you say, oh, everything's hunky dory and blah, blah. Then you come out and then you beat your chest and you cry. So we must know that there is something called vibrations, that they go through a wall. And so I tell them, utilize that time that you are shattered, utilize it for praying for the family. The power of prayer is immense. And I have some 20 positive thoughts which I give up to everyone, and the podcast. So I feel from personal experience that if you can change your mindset, which I said earlier, to look at something more positively, then it's just climbing up a ladder to a point where you can be yourself and good to go for many years. So I'm grateful to be able to share 28 years of my existence yesterday, Friday the 13th, 1998. And here I am with you. Thank you so much.
So, thank you so much. That brings us to the end of today's panel discussion, and it was great interacting with each one of you. So, thank you all, our esteemed experts and Ms. Neerja, Malik, for sharing such valuable knowledge and powerful experience today. And with this, we would like to conclude this session and tell that breast cancer awareness goes beyond medical information. It is about encouraging conversation, reducing fear, and reminding everyone that early action can truly make a difference. With the right awareness, timely screening, and supportive care, we can move towards better outcome and stronger survivorship journey. So, thank you to each one of you for making out time and joining the session.
Vaishnavi, what about that last thing about last final words from each of us? I would like to say something
Sorry?
here.
Yes, yes, please go ahead.
What I would like to say is, and I learned this from my father because I went to him when I was diagnosed and I said, Papa, I'm going to fight cancer. And he had taken premature retirement from the Indian Navy and he joined the Merchant Navy to marry two daughters and to buy two homes. And I was shocked because he got a mention in dispatches in the 1971 war. And he said to me, why do you want to fight it? And I thought that my father will be so proud of me. She's a chip of the old block. I have, pulled the missile boats into the Bay of Karachi and so on and so forth. The 3rd of December, they did it in 71. 4th of December, we conquered it. They became, I mean, why do we have Navy Day or Nausena Day on the 4th of December? For this reason, 1971. And this man turns to me and said, why are you fighting it? And I was shocked. The carpet had been pulled from under my foot because I said, then, Papa, what do I do? How do I deal with it? How do I cope with it? And he said, when you're fighting something, you want to destroy that person, you want to kill it, it's negative. I said, okay, what do I say? And he said, don't fight it, face it. So you don't have to only have cancer to face it. It can be failure in the exam, love failure, a fractured bone. So the first thing I tell my patients is, don't fight it, face it. Because that whole concept of I'm going to fight it and destroy it and hum honge kamyab, we will overcome. You see, just the word face, fight, there's such a difference. And then the second thing I tell them is, come join me. Because when you are done with this treatment, you will be the dada or the dadi in your community. And you know how I have tackled you. And you will be able to give your words of strength and encouragement to them. So there is a ripple after ripple of movement to overcome this. I wanted to share this. Don't fight it, face it with you. Thank you.
So thank you so much. Thank you to each one of you for making out time and joining. Have a good evening. Okay, bye. Thank you.
Yeah, thanks everyone. Thank you.
Thank you.